So, when a new public health threat just explodes onto the scene, it feels like total chaos, right? But what you don't see behind all the headlines is this incredibly structured process. It's designed to turn all that uncertainty into real, concrete action. And today, we're going to break down exactly how the experts pull that off.
Okay, just imagine you get this report. And no, this isn't some movie plot. This is a real-world scenario straight from a World Health Organization training manual. 22 people are sick with a severe respiratory disease, and 7 of them have already died. So what happens now? What do you do in those first critical hours?
That report, that strange cluster of cases, well, that's what the experts call a signal. Think of it like the very first blip on the radar. It's the alert that kicks a global safety mechanism into gear. And it's the exact moment a potential crisis is spotted and, yep, the clock starts ticking.
Now, you might think the response is just a chaotic scramble, but it's not. It's a cycle, a repeatable, systematic process that works for any acute public health risk. And what's really crucial here is that it's not about guesswork. It's about following a proven framework so you can make solid, defensible decisions even when you're under immense pressure.
So this cycle, it has 5 key stages. First up, you detect the event, which, we've just done with our signal. Then comes the deep dive, the risk assessment. And based on what you find there, you identify control measures, you communicate the risk, and then finally, you evaluate how you did. For this explainer, we're really going to focus on that super important second step, the assessment itself.
Okay, so the signal is confirmed. Something is definitely up. The first move, it's not to rush to the scene, it's to rush the right minds into a room. It is time to assemble the risk assessment team.
And just look at who's at this table. It's not just one type of expert. It's a whole multidisciplinary group. You've got your disease detectives, right? The epidemiologists. You've got clinicians, the doctors. But hey, you might also need veterinarians if you think it's coming from animals, or toxicologists if it might be a chemical. And this is so important. You absolutely need communication specialists and people with deep local knowledge. Why? Because they're the ones who understand the community, the culture, the whole context, and that is absolutely vital.
So you've got this incredible, diverse team, and they are all laser-focused on answering one single primary question. This question is like the North Star for their entire investigation. What is the public health risk of this event? Every single piece of data they gather is aimed at figuring that out.
Now, to answer that one big question, they don't tackle it all at once. They break it down into 3 smaller, much more manageable pieces. You can almost think of it like a detective's investigation, right? Following 3 distinct lines of inquiry.
First up is the hazard assessment. This is the what. Simple as that. What is making people sick? Is it a virus? Some kind of bacteria? Maybe a chemical agent? They literally create a list of potential culprits, kind of like a differential diagnosis in medicine, and then they rank them based on whatever evidence they have.
All right. Second, you have the exposure assessment. This is all about the who and the how. Who's most likely to get sick here, and how is this thing spreading? Is it airborne? Is it spreading through direct contact? Answering this helps them estimate how many more people could be exposed if they don't do anything.
And number 3, the context assessment. This is the where. They have to ask, is the local healthcare system weak and unprepared? Are there certain cultural beliefs that might actually affect the response? All these social, economic, and environmental factors can totally change the overall risk picture.
Okay, so the team has looked at the hazard, the exposure, and the context. Now comes the moment of truth. They have to combine all of that information to assign one single clear level of risk. This whole process, it's called risk characterization.
And really, it all boils down to 2 fundamental things. On one hand, you've got likelihood. How probable is it that this thing is going to spread further? And on the other hand, you've got consequences. If it does spread, just how bad will it be? And we're not just talking about health impacts here. We're talking about the social and economic fallout too.
So let's apply this to our scenario. The 22 sick, 7 dead. The team looks at the data and determines the likelihood of it spreading further is highly likely. And why is that? Well, cases are still popping up, and they don't even know the exact way it's spreading yet. And the consequences? Severe. The death rate is high, and the local healthcare system is already completely strained.
So how do they put it all together? With this, a risk matrix. It's actually pretty cool. The team plots their 2 assessments right on this grid. They find where highly likely on the vertical axis crosses with severe on the horizontal. And that intersection, that gives them their verdict.
The overall risk level for this event is officially determined to be high. And that one single word, it drives everything that happens next. It just cuts right through all the complexity and gives them a clear mandate for action.
So that crucial high-risk verdict, it's not just some label they slap on a report. No, it's a trigger. It's a trigger for action. This is the moment the whole process shifts from just assessing the problem to actively trying to solve it.
A high-risk designation means senior management gets alerted immediately. Urgent action is required, period. But the key word here, and this is so important, is proportional. The goal isn't to overreact and cause a panic or to underreact and let things get worse. It's to implement control measures that perfectly match the level of risk they just figured out.
And you know, when we talk about consequences, this framework thinks incredibly broadly, way beyond just the medical stuff. They look at the social impact, like stigma against certain groups. They look at the economic costs to trade and tourism. They even tackle those really thorny ethical questions, like how do you balance individual liberty against the greater public good?
Because at the end of the day, control measures are only effective if the public actually understands and trusts them, right? That's why communication is so deeply baked into this entire process. As the WHO manual itself says, building trust by being timely and transparent with information, that's the absolute foundation of any effective response.
So the big takeaway here is this. This whole systematic process, from that first signal all the way to action, it's like the unseen architecture of our global public health safety. It's the calm, methodical work that happens behind the scenes, the work that very often prevents a localized outbreak from exploding into the next global crisis.
And what's amazing is that this framework is designed for any hazard. But you know, it does leave us with a pretty critical question for the future. In a world that's more connected than ever, where a new threat can travel across continents in mere hours, not weeks, how do we make sure these systems are fast enough, strong enough, and trusted enough to protect us from whatever that next unknown threat might be?